So today we will be discussing the dynamics of a progressive lens. So for example, uh, this is a progressive lens. Okay, there's a distortion area on the side, and this one is for the distance vision. This one here, the intermediate, and hold on. Okay, let's do this again. Oops. Okay, so this is the lens. There's this distortion area here. Okay, this is for the distance vision. This is for the intermediate, and this is for the reading. Okay, this area here on top for the distance. This is what you use if you're, for example, watching a movie, okay, or watching TV. Okay, so this is what you will use, this area here. When you're using your computer, especially the desktop computer, you're using the intermediate, the one with the eye. Okay, here. This one is the intermediate area. This is the part of the lens wherein you're going to use while you are viewing intermediate distance. Let's say, for example, distance from 20, 22 inches away. We're at arm's length away. Okay, so that's the area here that you will be using. The one for reading, the one with an R, okay, the down side of the lens. This is the one that you use for reading at near, let's say about 16 inches away from your eye. Okay, so this part here is the distorted area. What do you mean by distorted area? That means this is the area that has a lot of astigmatism. This is the weakness of all progressive lenses. Now they have this distorted area on the side. So meaning if you are looking at far, you use this area here. When you're using your intermediate vision, you're using this area here. And when you're reading, you're using this area on the downside. Okay, but if you move your eyes from left to right, your eyes will hit the sides. If that happens, the vision will be a little blurry, but the worst is you will develop a headache. Okay, if you use that area for a long time, you will have this very scintillating headache. That's the reason why a lot of the patient will feel discomfort using the progressive lens, especially for first-time wearers, because when you use progressive lenses, you have to use head movement. When you gaze from left to right, you have to use head movement and not just eye movement. Because if you use eye movement, your eye will hit this area on the side, the distorted area. But if you move your head, that means the line of sight would fall. If you're looking at far, it will fall in this area. Okay, the distance area. If you're looking the intermediate distance, you're using this area here. Okay, the middle. Then if you're reading, you're using this area here. Okay, for reading at 16 inches. So that is the dynamics of a progressive lens. Now, if your lens is the more current, no, the more advanced type of progressive lens, the distorted area is smaller. Okay, most of the time this is a bit more expensive, pricey siya. But you can see, no, the distance area is wider. Okay, the intermediate is wider, and also the reading is comfortable. Okay, so you have all this space for your vision, far, intermediate, and reading, and the distorted area became smaller. Okay, there are also lenses for very active people, and again, pricey ni siya, but the distorted area is very small. Okay, so for active people, no, they play sports, all that stuff. The distorted area is already very small. Sometimes you cannot notice them. You can't notice them. No, so you can see here the one for distance. Okay, the one for distance so big, wide. The one for intermediate is also very wide. Okay, and the one for reading is very wide. Okay, so that's the more advanced technology, and you know naman technology mo mahal sad. Okay, so that's the dynamics of this type of lens, the progressive lens, because with the progressive you have different level of lenses. You know, they're fused together in such a way you don't see the lines or the separation. They're fused together, but there are lenses at the top area for far. Okay, and these lenses here are for intermediate, and these lenses here are for reading. Okay, just make sure you don't use the distorted area, because this is where the discomfort usually stem from. You know, you ask people around you, people that you know that use progressive lenses, especially the first time wearers, they will always say that they experience a lot of discomfort at first. You know, you need some type of adjustment period when you're using progressive lenses. Usually it's about 2 weeks. Okay, 2 weeks. For some people, no, it is a month. No? So different different level of adaptation. And some people can adapt faster, some people can adapt slower. Okay, so these are the things that you need to consider. The more you understand the limitation of the lens, the better the shorter your adaptation period becomes. Thank you very much.